This summer in Washington, D.C., we're hosting the International AIDS Conference. It's July 22nd through 27. Based on previous conferences, what can we expect to see in the city? What's sort of the atmosphere going to be like this summer?
Well, you know, it's interesting. These conferences started out in 1985 as gatherings of scientists. About 2,000 scientists got together in Atlanta just to begin to exchange notes on, what is HIV/AIDS and how is it spreading? What do we know about it? Now, the conferences bring together like 25,000 people. I think the biggest one was in Toronto a few years ago and had maybe 26,000 people. You have people from all over the world coming together to really talk about not just the scientific aspects of HIV/AIDS, but really what can be done politically and funding as far as bringing an end to the epidemic.
So the conference started in the U.S., but it hasn't been back in 22 years.
Correct.
What's sort of the backstory about that, and how important is its return this summer to sort of the global fight against HIV/AIDS?
Well, the conference, was pulled together with a coalition of CDC, Emory University, and the WHO. Brought it together in Atlanta in '85. It was held again in the U.S. in 1987 here in Washington, D.C., and I think had under 10,000 people, but it had grown even since then. But also in 1987, the United States put HIV on the list of diseases that could exclude a traveler coming to the U.S. from getting a visa. And this caused a lot of upset within the community working on HIV/AIDS, because over time people began to feel that it was going to be very difficult for those people most directly affected by the epidemic to participate in the conferences themselves.
And the travel ban was recently lifted.
The travel ban was lifted in 2009. And so there was a conference in San Francisco in 1990. But the politics of the visa were so really dominated a lot of the discussion at the conference itself that a decision was made not to have it again in the United States until the ban was lifted. So the ban was lifted in October of 2009, and the conference is coming back to the U.S. for the first time in almost a quarter of a century.
Over the years, how effective has this conference been as a tool for galvanizing support around HIV/AIDS?
Well, it's interesting. In preparing a report, kind of looking at the history and politics of the AIDS conferences, I've talked to a lot of people who have been longtime participants in the conferences. And one thing everyone says is that the conferences are really important because they bring people from so many different communities together. I think if you look at the history of the meetings, one of the most critical and one that people really point to as being significant was the one in Durban, South Africa, in the year 2000. And this was after the conference in Vancouver, when the scientific community revealed that clinical trials had shown that antiretroviral therapies really had the potential for the first time to not cure AIDS, but provide long-term treatment that might make it possible, as many people said, to turn AIDS into something like a chronic condition for people who had access to the medicines.
To give people sort of normal lives.
Right. And at the time, it was really envisioned that this was something that might take a long time to be able to spread throughout, particularly to get to populations that most needed access to these medications. But between 1996 and the Durban conference in 2000, there was really a kind of a coming together of the international civil society and activist community to say, it's really important that people in the developing countries have access to these life-saving drugs. And so in Durban, you really saw a conversation and really, the development of a momentum around putting pressure on governments to think, and pharmaceutical companies and others, to think about ways to make access to medications available for people in the developing world. It was shortly after Durban that you saw the Global Fund to Fight AIDS, TB, and Malaria founded. The G8 held a series of discussions that kind of put together, put a greater emphasis on HIV/AIDS in international discussions. Saw the launch of PEPFAR here in the United States for international work in 2003. And so I think in some ways you can really look at Durban as kind of a momentum or a push for international action.
Is the conference going to be able to sort of drive home the message that we can't stop now?
I think, the conference really does come at a critical time, because on the one hand, there have been so many scientific advances, really in understanding the virus and understanding, the transmission, and also understanding the ways in which some of the medications that are available can really help people. On the other hand, it's true. I mean, here in the United States, many of the other countries that have been longtime supporters of HIV/AIDS work programming are finding themselves in a budget crisis and really needing to think through ways to better partner with each other and create better efficiencies within their programs. And so I think, there's sure to be a lot of debate and discussion about increasing support for HIV/AIDS, but I think the conference also provides an opportunity for people who are on the ground, who are really seeing what's happening and how to be most effective, to share information with each other and really try to work, across sectors and across governments to identify ways to really kind of come together and meet what the conference goal is, which is called Turning the Tide Together. So,
thanks for your time today.
thank you.